The next issue that people commonly deal with a narcotic is itching. Believe it or not, it just makes kind of generalized itching in some people. The best way that I've found to deal with that is number one, to try a Benadryl. So just over-the-counter Benadryl every 6 to 8 hours can be very useful for that. And believe it or not, there's a medication called ranitidine, also called Pepcid. It's a medication that most people take for heartburn, but it actually helps with the itch too. So that plus the Benadryl will usually help people if you're really struggling with that itching. The next problem that a lot of people struggle with after surgery and after using a narcotic pain medication is nausea. Typically for that, I'm going to use an anti-nausea medication. There's a couple different choices that are out there. I think all of them are very good. Those are mostly available by prescription. And I would say that one sort of old trick that people know about is that if you take an alcohol prep pad and you smell the alcohol from the prep pad, a lot of times that will help with a wave of nausea just to kind of knock things down. The other problems that some people can deal with after surgery with a narcotic actually are a lot more dangerous than those. Number one is it does cause respiratory depression. What that means is that you don't breathe quite the same as that you would because it kind of pushes down those sensations that you need to take a breath. This is particularly dangerous in people who have obstructive sleep apnea. So for people who have that diagnosis of sleep apnea, we're really going to insist that you have a CPAP machine, well fitted and functioning, and please make sure you use that, especially if you're using any type of narcotic. The next thing that is also very serious is an overdose. So you really want to follow the directions that the doctor gives you very closely. Don't mix it with any alcohol. Don't use more than you're supposed to. That can actually be a fatal problem. So that's one we want people to take very seriously. And then the final issue, thankfully, has gotten a lot of press lately, and it's really very much needed. And that was dealing with people who become addicted to pain medications. What I think that people need to understand is this stuff is extremely addictive. Even if you think you're not the kind of person who might normally get addicted to things, if you take this long enough, you will get addicted, and nobody is immune to that. In fact, some of the studies have shown that even if you just take it for 5 days, at 1 year, there's a significant increase in the number of people who are going to be addicted to that medication. So I tell people that it is a very dangerous medication. I think it's very needed to get through that initial part, but you definitely want to take as little as possible, and you really want to get rid of those as soon as you can. The next medication that we commonly use after surgery is just plain old Tylenol, also known as acetaminophen. I think it's a very effective medication in some people, and I think it's very nice to supplement that with the narcotic pain medication. It doesn't have nearly the side effect profile or nearly the addictive potential. So I do suggest that people take acetaminophen if they're able to. A couple of warnings with that. Number one, do not ever exceed 4,000 milligrams in 24 hours. That actually can be fatal. That is a really big deal. Do not go past that number. The other issue is that some of the pain medications that you might get from your doctor actually have acetaminophen mixed in, and you may not know that. So you want to pay real close attention to that medication, because that does count. So if you have narcotic pain medication with 500 milligrams of acetaminophen mixed into it, and you supplement that with more acetaminophen, that actually can be very dangerous. So just make sure you're really paying close attention to those numbers. The next medication that a lot of people will use afterwards is a non-steroidal anti-inflammatory. This is going to be medications like ibuprofen, naproxen, that kind of thing. It's variable whether your surgeon really wants you to use that or not. I'm going to leave that to a personal discussion that you have with your surgeon, whether you think that's a good